might be pregnant, and that can be scary. Let's take a few minutes to think and talk about what this means to you. Anytime a man and a woman have sex, pregnancy can happen. It's how we all came into the world, some of us by accident. From the moment you become pregnant, your body responds with powerful changes that will support the pregnancy. When you become unexpectedly pregnant, it can feel like life has come to a stop. No matter what happens from this point forward, things will be different. However, life will continue on. It just changes direction. You have two choices, an abortion or a baby. First, let's talk about having an abortion. An abortion is performed by taking a series of pills or through a surgical procedure which will end a pregnancy by stopping the growth of your fetus and removing it from your body. First, an ultrasound is needed to confirm how long you've been pregnant and the type of abortion you can have. Many states require parental notification or consent before an abortion is allowed for anyone under 18. Abortive pills can only be taken very early in the pregnancy. These pills will cut off the nutrient supply to the growing embryo and cause you to have contractions, which push it out. Potential side effects include heavy bleeding, severe cramping, infection, and significant emotional stress. If the embryo is not positioned correctly in your body, the pills won't work. This can lead to severe internal bleeding and even death if not treated quickly. This will usually lead to the end of the pregnancy in a non-surgical manner. In cases where these pills fail, a surgical procedure is required to complete the abortion. Surgical abortions can be performed at any time during pregnancy. Up to 13 weeks, a long, thin tube is inserted into the uterus, which is attached to a suction device, and the embryo is suctioned out. Some of the side effects include severe cramping, an extended period of bleeding, and emotional stress. From 13 to 24 weeks, a more complicated surgical abortion is required. At this stage, the fetus has grown too large to be removed without the body first being cut into pieces before being removed by suction or manual instruments. This involves the use of cutting and removal tools, which makes the procedure more expensive and complicated. This type of abortion creates greater physical pain, is more dangerous to your body, and requires a longer recovery. After 24 weeks, there is a risk of the fetus surviving outside of the mother's body. Therefore, the doctor must make sure that the fetus is no longer alive before it is delivered or cut into pieces and removed surgically. It is difficult to find a clinic that will do this type of abortion, and the procedure is much more expensive. Many states don't allow an abortion at this stage of pregnancy. These types of abortions are often the most complicated and traumatic for the mother, having a higher risk of permanent physical and emotional damage. An abortion ends a pregnancy quickly, but it will still take some time for your body to recover from the sudden changes. Additionally, many women are caught off guard by the powerful emotions that follow an abortion. Now, let's talk about having a baby. If you choose to continue your pregnancy, your body will stay on its natural course through the birth of your baby. You can choose to be a parent or place for adoption. Choosing to parent means you get to hold your baby, give him or her a name, and help them grow. Parenting a child is rewarding, but comes with many challenges. Your relationships may change if your partner, family, or friends don't support your decision at first. You will have many new responsibilities. Likewise, having a child will create additional financial needs. Your body will undergo numerous changes. Some are exciting, like feeling the baby move, and some are unpleasant, like stretch marks. It is important to take care of yourself for your baby's benefit. You will need to plan for your medical care during the pregnancy, for your delivery, and for both you and your baby after birth. There are state and federal programs that can help with or completely cover these expenses. Choosing to place for adoption will allow you to maintain your current life plans, although there will be a temporary delay during pregnancy. Many couples who are unable to have a child are ready and willing to adopt, and you can select the adoptive parents. You can give the gift of life to your baby and the gift of a baby to a waiting family. Adoption is not without its challenges. You will go through the physical changes typical of carrying a child to birth. Your friends or family may not fully understand your choice, and you may face an emotional struggle to place your child in an adoptive family once he or she is born. However, you will not have to face the financial pressure or long-term responsibility of raising a child. Choosing between having an abortion or a baby is one of the most important decisions you will ever make. You are not alone. Take the time to think and talk about your options.